Beer can't fix it on 95.7 WCRC. Joining me now, Dr. Ryan Jennings, Chief Medical Officer at HSHS St. Anthony. Good morning, Ryan. How you doing, bud?
Oh, good morning, Gail. I'm good. I'm sneezing like everybody else.
Oh, yeah, these allergies, I'm telling you. You know, this could not have happened at a worse time than allergy season, because now I'm in the same boat. You know, we talked about this Friday. I've been running around for a month now warning people, because I have tissues in hand for the last month warning people, I have allergies, I'm not sick.
No, it's true. It's true. And we have seen some folks, coming into the emergency room because they're concerned. And, once you talk to them and go, don't you kind of do that this time of year?
Yeah.
Oh, yeah, I usually do. And
Yeah,
I'm not really running
yeah.
any fever. I'm just coughing and got a runny nose. And, say, well, let's try a little, over-the-counter antihistamine and see if we get you back on track. But, of course, it causes a lot of anxiety this time of year.
It does. I'm almost 65 years old, and I've had allergies. I remember I started taking allergy pills when I was 4 years old, and they tasted good. They were these little, they were the little turquoise-colored allergy, and they had like a candy coating on them or something, and most kids at that age can't even swallow pills. Shoot, I could take them without water. I had to take so many of them. So I'm used to this. I know what it is, and but I've constantly for the last month been holding my hands up going, I have allergies, I'm not sick, and I don't have the cough, I just have the drippy nose.
Yeah.
But yeah, I just feel like I have to warn people, I'm not sick, I have allergies. So I need a t-shirt,
Yeah, there you go. There
Yeah.
you go. Just allergies.
Yeah, it's just allergies. So yeah, so what have we got going on so far, Ryan?
Still we continue to be very fortunate that as far as actual disease prevalence, we've been very, very lucky and continue to have not seen any positive testing within our communities, which is fantastic. But again, it's still given us lots of time now to lead in to think more about how we're going to use resources, and already have seen situations where we're being asked to help provide resources to communities that have already been hit. And earlier this week you saw the Mavis tent came down. Now, that was partly because we were expecting bad weather, and we did not want to have that very valuable resource damaged by the thunderstorms that were supposed to roll through. But we're now, in the process of evaluating with our region where those resources are best deployed, and it's almost if it's not hourly, it's certainly at least daily of looking at the region itself and where folks are having challenges finding resources, and thinking about how in the long run we're going to use our tertiary care centers, St. John's and those types of things as as experts where we can tap into that resource, and also help to, as we've mentioned a few times on here, helping us to share supplies across not only our Region 6 designation, but also within our health system, so that we continue to meet the needs of the patients where they are, and take advantage of technology where it is. So really an incredible collaboration, and this little bit of calm before the storm has let us continue to work through a lot of those workflows and processes.
Yeah, and I believe that the fact that we are such a rural community, I believe that has definitely played in our favor so far, and I'm really hoping and praying that it will continue to play in our favor as this all plays out.
No, you're spot on. I think the design distancing of the rural community kind of has helped us, but that doesn't take away from the ideas of avoiding social situations, keeping
Absolutely.
that 6-foot distance. I did have to run in and grab some groceries the other day, and I was kind of surprised. There were several elderly folks, and there many of our stores, which is great, have set aside some special hours for some older folks to be able to get in there and not be when there's quite so much riffraff and commotion to minimize their risk. So we're really lucky to have businesses that have been willing to open up that as a service, and so please take advantage of that to, again, do everything we can to be reducing our risk, and the sanitizing and the hand washing and all of those things that we're all really well versed at now. Maybe we didn't think about it very much before, but boy, folks are thinking about it now.
Absolutely. And when you get right down to it, Ryan, they're simple things. They're simple precautions. They don't take that long, and yet they're so important. And we need to stress that, folks, it doesn't take that long to take these precautions, and yet they're so very, very important.
So true. And the other day when it was raining, I guess Sunday, and there was a beautiful rainbow here over Effingham, and it makes you think about, okay, when this thing's over, what does normal look like again? And
Exactly.
I've heard that from folks in the community, kind of saying, gosh, are we going to deal with this every year now, moving forward? And is this going to be kind of like influenza, where year after year, the virus evolves, and we're going to have a big mess? And there's a couple things that I think are reassuring. One is, as we've mentioned before, this virus has been out there for many, many years, but hasn't always carried the serious risk of death with it that this particular strain has. So as the virus mutates, it's difficult to know, could it get worse? Well, I guess it could get worse, but there's also every possibility that, it'll mutate and not be, quite as dangerous. The other thing, of course, is the tremendous work that's going on at a faster pace than ever around vaccinations and some of the other treatment options that are starting to come online. And, the innovation of this country around the calling when something like this strikes is just incredible to me. I mean, even within our own community, we have a little piece of plastic that breaks off sometimes on our face masks that we use, and so reached out to some folks and found somebody that's got a 3D printer, and the next thing you know, I got 50 of these things in my hand.
Wow.
And so when there's a calling, as Americans and certainly in this community, we always find a way to solve it. So although I'm sure there'll still be, something that is always out there lurking as far as these types of things, we're learning a lot, and we will definitely be even more prepared for whatever the next one might be.
Yeah, because I know, I'm glad you addressed that, because I know that is the thing that I'm seeing people saying, well, is this ever going to be over? Is it always going to be out there? Is there ever going to be a return to normalcy? But I know there are so many scientists and doctors that are out there working on this right now, and I have heard that they're making great strides in finding ways to actually treat this now. So that's so encouraging.
It is. And I mean, everything from, the ability to test more rapidly and more testing coming online that is going to be very useful for us to understand, who and when, to, again, the actual treatments, vaccines, et cetera. And so, I think we're on a great path to come out of this a better and stronger city and nation as we work our way through these challenges.
Right. And there was something else I know you wanted to touch on this, but there's scams going on, as there always are whenever there is emergencies going on like this.
There's always somebody looking to make a buck.
Oh, yeah, and take advantage of people during the worst times.
Yeah, so just be cautious as you see some of these things online, and everything from medical equipment that's probably the mask and those types of things that are probably not really of adequate quality and grade to be spending your money on, to testing little finger stick blood tests and things like that to say if you've got it or if you're immune to it, and I mean, there's definitely lots of research going on around exactly that, because those types of things will help us. But if they were of adequate quality and adequate sensitivity to the disease and had been validated, trust me, I'd have them.
Exactly. Exactly.
And so please, don't get caught up by somebody that's trying to make a quick buck, which unfortunately is just part of it, And when something like this happens, somebody's always taking advantage. So
yeah, and another thing is that we need to make plans.
We do. This is a really a great topic, Gail, and one that we've talked about as a hospital and as a community from time to time about having those difficult conversations with your family and with your physicians. This is one of those situations where when resources are what they are, and you have something that carries the risk of impacting a lot of people and straining those resources, your family members and your loved ones need to know what you want to do. If you happen to be someone that suffers from this. I know when my mother had lung cancer, she was spot on, crystal clear. I'm never doing this, or this. Okay.
Yeah.
Got it, Mom. Not a problem.
Right.
And those are really tough conversations. But I'll tell you, when it really gets to the bedside and difficult decisions are being made, having voiced your wishes ahead of time is incredibly important. I mean, it helps everybody. It helps your family to not feel like they're put in a situation where they're not sure. It helps the doctors and the nurses and the staff that are caring for you to know exactly what you want. So please, of course, we're always available as a resource here. Your churches and things like that have a lot of resources, and there's actually a really slick thing out there called the Conversation Project that we've mentioned a few times on various educational events. That's a website. It's conversationproject.org, and actually has kind of a toolkit for loved ones to just walk through and help you to think about maybe some things that you don't normally think about. What am I going to do with the dog?
Right.
There's stuff like that there's one thing to be thinking about, the big picture of as far as going on ventilators and things like that, but it also brings up a lot of, kind of odds and ends that maybe aren't top of mind. So absolutely seek out that resource. But, I've talked to my team here and my own family and really encouraging people. When I talk to my team here, they think about it in relation to talking to patients and families about this. And, I said, reality is your sons and daughters and mothers and fathers, and, you need to be having these conversations within your own family, not just with our patients that come in. And even as healthcare workers, they kind of go, oh, wow, didn't really... I think about it being somebody else, and
right.
and reality is it could be any one of us that has to make some of these difficult decisions.
Right. Yeah. I mean, I've actually thought about that. I've had that conversation with my daughter. I've had so many surgeries, and there's that possibility. We know as a doctor, you've had to have that conversation, I'm sure, with patients every time you go under anesthesia. There is that possibility, and I've had 27 surgeries and or procedures where I've had to go under anesthesia, and I've had that conversation with my daughter. It is a fact of life, and she knows what I want, and I've got this mean little 13-and-a-half-year-old Maltese that, I think, what in the world would happen to her, because nobody would want her, But, it's something I've had that conversation with my daughter, because I don't want her to be left to wonder.
Absolutely.
I don't want that burden on her. I want her to know what to do if something happens, And it is a fact of life. It is the circle of life, and it's something that we all have to face.
It is, and so many folks here. I mean, it's part of why I love this community. I mean, we're very family oriented. We're very practical, along with being incredibly innovative. And so many times when you start talking about being away from the community for care, folks go, well, no, I'd rather be here. I'd rather be here with my family, and we'll use the resources that we have. But at this point in my life, going to some crazy place out of town and still not be able to visit your loved one because of all the visitor restrictions,
right,
doesn't make sense. And so again, those are really difficult conversations, but there are resources out there to help you have those conversations.
That's right. And that you said that's called Project Conversation. Is that what that's called?
The Conversation Project.
The Conversation Project. That's great
Project.
to know that's out there.
And yeah, it's a really slick toolkit that they have, and like I said, as I went through it, I'm like, well, I never even would have thought about that,
Yeah, exactly.
And so yeah, please take advantage of that. Talk to your healthcare providers, and most importantly, talk to your families.
Absolutely. Brian, we appreciate you taking your time out, because, like, you're not busy right now.
Not as busy as we might be. So
right.
I'll take this opportunity to help folks to understand and to remain calm and to continue to do those things that are keeping us safe.
Absolutely. Thank you so much. And we're looking forward to talking to you later on in the week. And we're still hoping for more good news with, no reported cases, hopefully later on in the week as well.
Let's hope so.
Yeah, saying those prayers for that.
Yes, ma'am. You stay safe.
You too. Thanks so much, Ryan.
Bye-bye.
Bye-bye.